very warm welcome to all of you. We are gathering here today to talk about the health case for clean air investments in Africa in the run-up to the Africa Clean Air Forum that is happening next month in Pretoria, South Africa. Of course, for some of you, this is not going to be new information necessarily, but what we are hoping to do is hear from a variety of experts who have been thinking and working on the issue of air pollution and health across the continent, why it matters, the role that we can all play as individuals, as professional societies. We're very excited as the Health Effects Institute to be partnering with the Africa Clean Air Network, the Pan-African Thoracic Society, the Makerere Lung Institute, the South African Medical Research Council, and others to organize this webinar and to host this conversation. My name is Pallavi Pant, and once again, I'm really pleased to welcome you all to today's conversation. To get us started, first, I would like to invite Dr. Obianuju, who's the president of the Pan-African Thoracic Society, to offer opening remarks and get us set up for this discussion.
Thank you, Pallavi. Thank you for the introduction. On behalf of the Pan-African Thoracic Society, I welcome everyone to this very important webinar. And you may ask, why are we talking about air pollution? Why is there a need to make a case for investment for air pollution in Africa? We all know, as clinicians, as people who work in health, in the health space, we know that air pollution is the leading and health risk factor for death globally and the second leading cause of death. And we know that the lung is so important when it comes to the effect of air pollution because that's the route where we inhale and then we can get from the interface and the route for those pollutants to get into the body. So that's important. And that's why as Pan-African Thoracic Society, we think it's important that we contribute to making a case for air pollution investment in Africa. Unfortunately, you don't see this air pollution, and that's the reason why Africa is disproportionately affected, because we don't see it. There's limited research on the health effects coming from Africa. Therefore, the policies are not there, and even when they are there, they are rarely implemented. So as a professional society, we need to advocate, we need to contribute to the conversation on why there should be increased investment in air pollution. Increased investment in making a case for a cleaner air. Also, when we talk about who is affected, we know that young people, adolescents are more affected by the health effects because their lungs are growing. That is a very critical part in what happens to the rest of their lives when it comes to their lung health. So if we think about protecting young people, protecting the adolescents and making a case for an older, healthier life, we need to mitigate the health effects of air pollution. Also, we know that when it comes to the policies, we need the research. And the conference coming next week is where it gives us a voice. And health is one area by which, if it's affected, people listen. So we as healthcare workers need to educate not just the policymakers, our patients, and to be able to realize that we hold a responsible position to influence what happens. Africa has a lot of risk factors for air pollution. So when we talk about poor health, we have indoor use of biomass, we have traffic-related air pollution from old used cars, we have dump sites, so many risk factors. So it's important that we contribute to this conversation. So to go ahead, I would like to invite Lisa, who is a young person, to share the effects of air pollution on their health, how air pollution in Africa has affected their health. Lisa?
Obianuju, I think we are not able to play her video right now due to a technical difficulty, so we can move to Maria and then I'll try to bring that up.
Okay. All right. Okay. So when we have the video, she will tell us about the impact of air pollution on her health. So We'll then have Maria tell us about the health effects of air pollution. And so welcome, Maria.
Thank you. Thank you very much. And I'm so pleased to hear pediatricians and so committed and so much involved on this. I think the voices that can add an incredibly powerful and beautiful argument on why we need to invest on clean air for Africa. And of course, how do we do to protect people's health in Africa by reducing air pollution? For those of you who think that air pollution is an environmental threat, let me tell you, it's not. It's not just an environmental issue. It's probably one of the biggest public health emergencies, public health risk. And of course, Africa is not protected, is very vulnerable from this public health issue represented by air pollution. And you know, it's not only an environmental issue, an economic issue, but it's fundamentally a health issue. There is no organ in our body, almost no organ in our body that will not be affected by exposure to air pollution. So the health risk is enormous. Of course, our respiratory system will be affected, and this is something that maybe is very obvious, very visible, and very clear for many people listening. We will expect respiratory diseases. We will expect exacerbation of chronic disease, respiratory diseases, obstructive chronic respiratory conditions like asthma. We will expect in the medium and long term lung cancer. We will have infectious respiratory diseases as well, exacerbated by this exposure to air pollution. But not only the respiratory system, the particulate matter, those toxic particles in the air we breathe, they will go to our bloodstream and then be responsible for, accelerate, increase the heart diseases risk, of course, it will go for stroke as well. And we will have diabetes. We will have problems related to adverse pregnancy outcomes and even neurological disorders. So I think this package of negative health effects will give us already a massive and very powerful reason why we need to invest, why we need to advocate for clean air, why we need to protect African population from this massive problem. But the opportunities are there. And understand what air pollution represents for them. If pediatricians and other health professionals, they raise their voices, they explain what this represents, I think we will have a very good case and opportunity to promote, one, investment at the household level on accelerating the transition to less pollutant fuels at the household level in order to allow our people in Africa to cook, to lightening or to heat the house. You will need some better fuels. You will need cleaner opportunities, and of course a change maybe in the subsidies on the facilities to accelerate this transition by promoting some changes on the government policies on the importance of indoor air pollution. But the other opportunity is very much on outdoor air pollution, ambient air pollution, particularly because Africa represents probably one of the biggest, together with Asia, urbanization trends. You have a population that is getting very quickly moving to urban areas. So there is a massive movement to big cities in Africa, and therefore this urbanization needs to be planned, and we need to make sure that people will have access to sources of energy, but those sources of energy should be the cleanest possible. And this is where we need to make sure that we provide the health argument to accelerate the transition to renewable, cleaner, more sustainable sources of energy. We need to accelerate the transition to solar energy, for instance. There is no reason why in Africa, where we have an incredible source of energy, which is for free, we have the sun, and we don't have a solar panel in every house or every hospital or every health facility, when the prices of those technologies are now going very much down, and they are much more accessible, and they are probably something that the citizens need to fight for it, and push the politician for accelerating this transition to renewable energy by having the technology that is needed. But as I mentioned, the technology today is very cheap compared with a few years ago. So we have these two opportunities in Africa to change completely the situation in terms of air pollution. Indoor air pollution, accelerating this access to cleaner sources of energy at the household level, and facilitating that at house level, we will have better opportunities for cooking and heating and lighting, maybe through a transition, maybe through LPG as a transition, but reducing pollution there. But then at the same time, accelerating the electrification of our healthcare facilities, our health system, by solarizing or wind energy as well, and making sure that our population will have access. And at the same time, the prices will be going down. So it's time for Africa to manage this massive urbanization that you are facing at the moment, and the need for sustainable public transport, changing that, looking at the industrial development as well, and making sure that you do it, not making the same mistakes that we did maybe in other parts of the world, but learning from those mistakes and taking the best of the new technologies. And of course, making sure that the new buildings, the new materials that you use for these new cities that are now becoming so important in the African continent, how can we put all of these things together and at the advantage of our population, from economic point of view, from health point of view, and from the development point of view. Another challenge we have in Africa, and we are trying from a scientific point of view to mobilize partners to improve that, is the monitoring the quality of the air we breathe. So several challenges in front of us, but I think all of them can be sorted out. We can move those obstacles if the voice of the health professionals, the scientific community, does engage on climate change and air pollution, moving in the same direction. We can obtain better monitoring of the quality of the air we breathe, better policies in terms of indoor air pollution and housing fuels, better policies for healthy urban planning and electrification with renewable sources of energy, better representation in the international fora like the COPs or other international opportunities we have to push the case for Africa, and leading by example as the health system by reducing our own carbon footprint, and by having solar energy that will respond to the needs of our health system, and at the same time mitigate and adapt to climate change. And of course, at the same time, leading by example somehow as a rich continent, as a young continent, mobilizing those donors, making a very strong case for them for investment, because the results can be so positive. The results will be in terms of millions of deaths avoided, millions of diseases reduce, the prevalence of diseases reduced, the cost of the hospital and the health system will be massively reduced, and Africa could take advantage of the resources they have, and at the same time that we protect our health, we protect the economy, and we make Africa a more sustainable continent. So thank you very much for this opportunity, and I really love the African continent. I've been privileged to work there several years, so I will love to see this young population taking advantage of the resources they have, transforming them on something that will be protecting the health of the people instead of damaging the health of our population. Thank you very much.
Lovely. Thank you so much, Maria, for that inspiring opening to the conversation. I believe that Pallavi, you will then take the panel discussion next.
Yes.
So we
And
can hear from the rest of the panelists. Yes, thank you.
absolutely. Thank you, Maria, for those very encouraging and positive words. We also wanted to bring a youth perspective into this conversation, which is very critical, and also the perspective of people that may be living with exactly the type of conditions that you were referencing that air pollution can cause. So I'm disappointed that Lisa was not able to join us in person, but just as I pull up her video, she is a medical student in Cameroon, has lived with asthma, unfortunately, for a long time, and is really committed towards air quality actions. And here's what she wants to share with all of us today.
Hello everyone, up with the course video episode
Yes.
respected ladies and gentlemen. My name is Nagalisa Posama. I am 18 years old from Cameroon and I live with asthma. I'm going to share my personal story, how air pollution has shaped my life, and why I believe that clean air must be recognized as a basic human right. I was diagnosed with asthma when I was just 6 months old. From the very beginning, my life involved inhalers, medication, hospital visit, and many sleepless nights. One of my earliest memories having my first serious asthma attack at just 5 years old. I was playing with my siblings carefree when the air filled with fumes from a nearby car repair shop invaded the atmosphere. Suddenly, it felt like someone was pressing on my chest. I collapsed, gasping for air, and I was rushed to the hospital. I'll never forget the fear in my mother's eyes as she watched me struggle to breathe. That moment was terrifying, and little did I know it was only the beginning. In my community, air pollution is part of our daily life, from the burning of waste to cooking with firewood to exhaust from vehicles. For me, this exposure meant constant asthma attack, coughing, wheezing, and frequent hospital visits. My life became focused on avoiding asthma attack instead of simply enjoying childhood. But at 16, things began to change. I became a clean air and climate health ambassador, speaking to students and policymakers about the dangers of air pollution, not only for people like me, but for the entire community. Around that time, my family and I moved to an area surrounded by trees and cleaner air. For the first time, I experienced what it was like to breathe freely. My health improved, and so did my hope for the future. That's why I was proud to support this program. Not just to tell my story, of course not, but to remind decision makers that real people are living this crisis every single day. Clean air is not a privilege, it's a right worth defending. Today, I am a second year medical student and as well as the Vice Secretary General of Akatok Medical Student Association. My own experience has inspired me to study how environmental factors like air pollution affect children's health. I strongly believe that medical education should include environmental and air pollution health so that future doctors can better recognize, prevent, and manage these challenges. But my story is not only mine. Millions of children around the world are growing up in environments where the air they breathe is silently damaging their lungs, their heart, and their futures. Air pollution is not just an environmental problem, it's a health crisis and also a justice issue. Because the most vulnerable, especially the children, are the ones.
So here's a very, very clear call to action for both better awareness and understanding of how air pollution can impact our health, and also that, the change can come at many different levels. We need investments at the very large scale, of course, to clean the air, but at the same time, we also need investments in making sure that our upcoming healthcare practitioners know about air pollution and can respond to it and can talk about it. So I'm really excited to have an excellent panel here of speakers who undoubtedly have also worked with patients like Lisa, students and children like Lisa. And I know for a fact that the first person I'm about to invite, Rebecca Nantanda, from the Makerere University Lung Institute, has treated patients like Lisa many times before. So Rebecca, over to you for your perspective on the role that air pollution, especially household air pollution, is playing in impacting children's health in particular.
Yeah, thank you, Pallavi. And I think picking on from where Lisa ended, for Lisa, air pollution was a visible presence in her life. But for many people, air pollution is invisible, and yet it causes devastating effects on the health of children, but also their care providers. And because children are affected, and because I'm a pediatrician, I'm going to speak largely about children. So it's a public health issue, but most important, it's also an economic development issue. And for children, it's specifically very unfortunate because even before they take their first breath, they're already affected by the effects of air pollution. And this is how. When a pregnant woman is exposed to high levels of air pollution, for example, when she's cooking, the tiny particles enter her lungs, find their way through the bloodstream into the placenta, where they affect the placenta. And we all know that placenta is the lifeline for the children, for the babies when they're in their mother's womb. But it doesn't stop there. It also directly affects the organ growth and development, including the lungs. And what does this mean? It means that by the time these babies are born, they're already exposed to high risk of a multitude of problems. For example, we have evidence from Africa that babies whose mothers were exposed to high levels of air pollution from household cooking, for example, are born when their lung function is low. And what this means is that they're going to have higher risk of developing pneumonia, tuberculosis, asthma. Even when they grow into adults, they will have a high risk of having chronic obstructive pulmonary disease. But beyond the respiratory system, these children are also likely to be stunted, shorter than their counterparts. They're likely to have anemia, but also very important for economic growth and development is that they are likely to have neurocognitive problems. What this means is that their reasoning, their thinking, their comprehension of issues is going to be lower than those children who were not exposed to air pollution. And so this makes it really an economic problem because with all these problems, including, for example, where we have 50% of pneumonia cases attributable to air pollution, where we have 40% of exacerbations of asthma in children attributable to air pollution exposure. This means that these families spend a lot of money treating these conditions. But also in terms of economic development, it means that we are going to spend a lot of money, but we are also going to lose productivity. And so the affected families, the affected individuals actually have problems. And so we really need to clean the air for the children, but also for everybody. And to put it in context, in Africa, more than 90% of households use biomass fuels like charcoal and wood. And it means a whole lot of population are exposed to air pollution from household cooking. And so you can see how much productivity or unproductivity we actually have because of air pollution. But having said that, there is a lot that needs to be done. We still have some information that we require to make the correct strategies or the contextualized strategies. For example, we're asking ourselves, how much does air pollution cost? What does it mean if somebody is affected by air pollution in terms of the individual health, the expenditure on the quality of life of the families, the communities. What does it cost to the health system managing conditions which are related to air pollution, which would otherwise have been prevented? The repeated asthma exacerbations that Lisa talked about, the repeated admissions because of severe pneumonia. What does it cost the health system? But also to governments. What does it cost when there is low productivity because people are sick most of the time, because people are not going to work, because they are taking care of their children, because they are using these household polluted fuels. So we need to look at it from the perspective of both the health, but also understanding that because people are not healthy, then we're not productive. And so we really need to make a case to invest in clean air for our health as individuals, for a better quality of life for our families and communities, for the health system not to be, having a heavy workload because we are having repeated hospital visits. But also very important, I think we need to invest in that, in clean air actions for improved growth and development of the, state economies. So I really call upon people, including the general population, healthcare professionals, the people who are investing in clean air actions, the researchers. We actually need to step up our game and start looking at clean air, problems beyond the individual health, but also look at it as a broader health system challenge, as well as a national challenge. I'll stop there for now. Thank you, Pallavi.
Thank you very much, Rebecca. I think you're, raising a lot of really important and interconnected points, because often we tend to silo our conversations and talk about health in one bucket and one pillar, and then talk about air quality management in a different one, and maybe financing in a different one. But what we really need is to bring all of these pieces together, to collaborate more, to engage with each other more. And I think from the continent, we have a really excellent example of collaboration across different types of organizations, across countries. So I'm very happy to be welcoming our next panelist, Dr. Bertrand, who is part of the Clean Air Africa project, and is hopefully can tell us a little bit more about cross-border. Oh, I think I'm hearing an echo. How cross-border collaborations, partnerships, and generation of local evidence can help strengthen the science policy engagement. Bertrand, over to you.
Hello.
Yeah.
Hello, Pallavi.
Yeah, we can hear you.
Okay. Yeah, thank you very much. Hi, everyone. So I'm happy to be part of this panel. So I'm Bertrand. I'm from University of Douala and Douala General Hospital, where I'm working as a chest physician. And I will start by what I observe in my clinical practice, and that's what brought me to the issue of air pollution. And I think Uju, who is here and also an adult pulmonologist, will not say no, because in our clinical work, we receive patients like women of a certain age presenting with respiratory symptoms, and you finally have a diagnosis of chronic obstructive pulmonary disease in a patient who has never been exposed to smoke, to tobacco, and who has only as exposure smoke from biomass. That's was really what I saw, and I start looking very close to indoor air pollution. And in the project Clean Air Africa, based in Liverpool, and involving other countries from the continent, Cameroon, Kenya, Rwanda, Uganda, and Tanzania as well. So we started doing some research to prove to have the evidence on the reality of air pollution. That's why we did a lot of exposure air pollution measurement, carbon monoxide, and PM 2.5, and we had evidence on the presence on the harmful effect of biomass fuel on health, because we also did some of the health studies showing that respiratory symptoms, COPD, as well as eyes problem were more frequent in population exposed to biomass fuel. And in this perspective, in the consortium, we're working on how to facilitate the transition to clean energy. And we could have some evidences in our different countries that factors like affordability to LPG and lack of training of populations are the factors that can act as barrier to the transition from biomass fuel to LPG. And also, in this consortium, we also act on the capacity building, because another observation is that in our medical schools, we usually don't have a stress on during the training on the harmful effect of air pollution. That's why in this consortium we could have some of the session workshops in different schools and universities in order to bring up the fact that air pollution and indoor pollution is really a reality, and we think we should also advocate for the modification of curriculum in some of our schools, nursing schools, and even medical schools. And still in our consortium, I think in terms of research, we think evidence are growing in our continent, and we could be happy now because in some of our countries we could now measure air pollutions. And I would also like to thank Pan-African Thoracic Society, who could facilitate with so many workshops on air pollution. And you could see now in many sub-Saharan African countries, we have low-cost sensor being used for small studies to bring up the evidence of air pollution in different areas. And we are happy now because in Kenya, we now have a center for excellence on air pollution. We could support research on air pollution in our different countries. And also, a part of doing this research, capacity building, we need also to engage the community, because they are the one using the different fuels for cooking. They should be convinced and being trained to use LPG and electricity as well as cooking fuel. And Maria was bringing up the use of solar energy, and I think it's really the future. Maybe the cost is currently very prohibitive in our continent, but we hope within the coming years it could be really affordable and being used by our different population. Solution for this transition to clean energy. And finally,
It looks like
to facilitate the transition to the use of cleaner energy. Thank you.
Thank you very much, Bertrand. That's really helpful. And I think I will also add the work that has been done through this project already, including the new Air Pollution Center of Excellence, will hopefully be really relevant for others who are interested in conducting more air quality related work and even generating local evidence. We've heard so far from several panelists about the need and also the impact that air pollution has on children's health. But over time, as people get older and we continue to get exposed to air pollution, there's also a risk for non-communicable diseases, the chronic diseases, heart disease and lung disease and cancers in some cases. And slowly, the burden for these non-communicable diseases is increasing across African countries. I'm really delighted to be welcoming now Labram from the NCD Alliance in Ghana, who is going to talk a little bit about this NCD burden and also where you see progress happening. Over to you, Labram.
Right. Thank you so much. I'm delighted to be here, and congratulations to my panel speakers and panelists. I think that this conversation is very important, and it has come. I would say, well, better late than never. So let me begin by saying that one of the leading preventable causes of death in the world today, we all say, is non-communicable diseases, because these are largely human-made. So to that extent, you cannot also, separate air pollution from non-communicable diseases and from the devastating crisis we are experiencing in our world today. And of course, anytime the data and global data is changed, you would see a trajectory where Africa or developing countries are bearing the higher brand of NCDs or any disease at all. Right. So having said that, I wouldn't belabor the point, but let me just say that many African countries lack comprehensive air quality monitoring tools, to ascertain the extent to which air pollution is concentrated in a particular area. And even where these, monitoring tools or stations are available, they are often concentrated, in bigger or major cities. Provides limited national coverage. To that extent, it's become very difficult to even measure the extent to which air pollution is happening in some particular areas. Now, having said that, when you look at what happens in Africa, especially in my part of the world, where we sleep in air pollution. A practical example, you could see clearly when roads are being constructed, and you will see a clear difference between when roads are constructed in Africa and then when roads are constructed in developed countries. That's where you see dust and people are living in it. People are struggling. Whether in your home or on the street, everywhere is dusty. So the point is that we need to begin to learn from best practices on how to ensure that even when road constructions are being done, people are still protected from the devastating air that they breathe in, which is bad. There is also insufficient local evidence, linking air pollution exposure to public health or specific health outcome. And indeed, let me say that's also one of the biggest problems I have experienced in my part of the world, where you would find the Ministry of Health, focus on health matters, but when it comes to matters of air pollution or issue of climate change, it is disconnected from the Ministry of Health to the environmental ministry. So you find programs and projects going on within the ministry. So, for instance, we have the national NCD policy and strategies, for instance. Can you imagine how they call it? Such a beautiful document, don't have any component of air pollution, which we all know now that is one of the leading preventable cause of death, in the world today, and effort must be done to curtail those things, right? We also have a similar example in a community in my country, where research shows that, when it comes to prevalence of chronic respiratory and lung diseases, you would find that majority of people living in those catchment areas have those. And it is nothing but because people were burning, used ties or were burning electronics. Basically, that's the half for it. And there were also residents there. So this also increases the prevalence of non-communicable diseases, in our part of the world. So there's limited economic evidence, quantifying the cost of inaction and the return of investment of the airports. I think that has been mentioned already by some of the speakers. So there's a need for data, because every now and then, once you begin to talk to policymakers, and this is what I do a lot, they will tell you that we need data, we need evidence to substantiate, the cost of action and the cost of inaction. Where is the data to prove that indeed, air pollution is causing respiratory conditions and stuff? Because we don't have the local data, and that is what policymakers would always require us to do. So, and one of the key things that I will speak of is the fact that we should be able to have data to substantiate the fact that non-communicable disease is rising, but air pollution is also one of the major risk factors for the rise of non-communicable diseases. I will just end by saying that one of the speakers spoke about the fact that the human mind is growing, and indeed, when it comes to air pollution, I would say that issues of tobacco, yeah, we've done well. We've been able to regulate tobacco smoke largely in many countries, also even in Africa, where we are expressing, the low prevalence of smoking, which is good. And I think we need to translate that to other, to air pollution, looking at it from industrial, perspective. But again, one of my key solutions I will give is that if we're able to let the make big polluters pay principle also work, it also helps to reduce the extent to which we expose people to air pollution. So when industries are given the opportunity to construct roads, can we ensure that issues of health, air pollution matters are also properly, put in proper context, so that they don't expose, communities to unnecessary, diseases or increase lung and respiratory conditions. I would end here. If there are any other follow-up questions, I'm happy to respond to you. Thank you so much.
Thank you very much, Labram. I think this was great, and hopefully we can come back to some of the points you're raising in the discussion section. We are hearing a lot about the types of things that can be done, that need to be done. And I think it's only fair that we also hear about things that are being done actively. I know that Obianuju has been posting some things that their group has been doing in Nigeria, but I'm really happy to now welcome Dr. Claire Proctor from the South African Pediatric Association to talk a little bit about how they are thinking about the air pollution and health linkage and trying to engage different communities. So over to you, Claire.
Thanks so much, and thank you for having me here today. I've got a couple of slides just to share, which I'm just going to bring up. So yeah, as Pallavi said, my name is Claire Proctor. I am the treasurer of the South African Pediatric Association, and I'm also coordinating this project, which was brought to us by the Royal College of Pediatricians in London, the UK, because they were approached by the Clean Air Fund to gather pediatric associations together and to do some of this work that everyone's been talking about. So gathering some evidence and advocating for clean air. So SAPA has been putting together this project, and this is my wonderful team. We are a bunch of mostly pediatricians with or child health advocates, and we're working across Cape Town and Johannesburg. And the plan of what we wanted to do was to raise awareness amongst pediatricians, to get them to become advocates for clean air and child health. As everyone's talked about the issues, we don't need to go over those, but to make sure that all our pediatricians knew about it, to become advocates at their own local level, and then also nationally, and maybe as spreading internationally. So we decided to do a research project. It's not going to be massive data that we can do huge things with, but at least try and produce some local data to show the impact of air quality on child health in the Highvelds in Johannesburg. and then use that to advocate further SARPA at a national and international level, and see if we could bring all that together. So, as I've said, we are doing a research project, but we're also looking to build these champions. We want to create sort of a network of champions across the country who will integrate environmental exposures into just routine history taking. Are we teaching our medical students? When you ask about this, ask about what fuels you use at home, ask about smoke exposure, ask about, do you live next door to a mine? You know, what is your personal exposures? And what can you do? And we hope to develop toolkits both for healthcare professionals, maybe even for our patients, to minimize those risks that they are exposed to as much as they can. We want to engage with the community and see if there's things that can be done around those especially high-risk areas, which we know that South Africa has, particularly in the high veld and around Johannesburg. We hope to reach out to the clinics and as I said, provide materials. And then we want to put all this together and bring it to our National Department of Health. We sit on an air quality forum, which is looking at all of these issues. We plan to create a policy brief, and obviously we're looking to work with all the other organizations, of which many are on this call, which is amazing. So we want to build those links further. And then obviously continue to share with the Clean Air Fund around the world. So what we're doing at the moment, we've got a study that we're busy putting together on air quality and pediatric admission data in Johannesburg. We're going to do a member survey of the South African pediatricians and see what they know. And if they're interested in this topic and what we can get them interested in. We're going to have a webinar. SARPA runs monthly webinars. We will be planning that for early next year. And hopefully at our SARPA conference later next year, we will have a whole workshop on this topic. We are providing training. As I said, we want to create this network. We're putting things out there in as many materials as we can, and building on that policy brief to present, and I'm presenting at various conferences. So this is what we're working towards. I think I've been through most of that, so I won't repeat myself. But we really want to position SARPA as the center of child health and air quality discussions in South Africa. And this webinar and the forum, which we will have representatives at, seems like a really great way of doing that. And I hope that others will take up the challenge to do the same stuff. Thank you very much.
Thank you very much, Claire. I think those are hopefully interesting ideas for other associations across the continent to consider, and potentially even beyond the continent. I think a lot of our conversation so far has been focused on how air pollution is impacting our health, children's health, but we do know also that the climate is changing, and that is bringing even newer threats that we may not necessarily know everything about. Those are also very likely to have impacts on our health. So as our final panelist, I'm really pleased to welcome Dr. Natasha Naidu from the South African Medical Research Council to comment a little bit on how we know and what we know about the ways in which things like air pollution and heat might intersect to impact people's health moving forward, and what kinds of, again, policy interventions or considerations do we need to think about today and now so that we can still achieve our goal of clean air for all. Over to you, Natasha.
Hi, Pallavi. Thank you for the introduction. I'm actually standing in for Professor Makerere, right? Who is our Chief Specialist Scientist at the South African Medical Research Council. And when we think about looking ahead, Air quality and extreme heat are likely to become two of the most important environmental health priorities for policymakers in South Africa, not only because they are individually harmful, but because they often occur together and amplify health risks. A lot of studies don't take this into account. And climate change is increasing the frequency, intensity, and duration of heat waves, while population growth, urbanization, industrial emissions, household fuel burning, transport emissions, and wildfires continue to drive poor air quality. So, what do we know so far? South Africa already experiences some of the highest levels of air pollution exposure on the continent, particularly in priority areas such as the Highveld priority area, where we do most of our studies, and including the Vaal Triangle Airshed priority area and Waterberg-Borgenella priority area. Research has consistently linked exposure to particulate matter, nitrogen dioxide, and other pollutants with increased mortality, respiratory disease, cardiovascular disease, pneumonia, and adverse pregnancy outcomes, as one of the panelists has also described. At the same time, evidence from South Africa demonstrates that high temperatures increase deaths, hospital admissions, dehydration, kidney disease, heat exhaustion, heat stroke, and adverse mental health conditions. Studies from Gauteng have identified clear heat health thresholds, with mortality risks increasing substantially during hot periods. Vulnerable groups include older adults, young children, people with chronic diseases, outdoor workers, and residents of informal settlements. Importantly, air pollution and heat often interact. Hot weather can worsen ozone formation, increase wildfire smoke, and trap pollutants in urban environments. Exposure to both heat and air pollution simultaneously can place additional stress on the cardiovascular and respiratory systems, leading to greater health impacts than either exposure does alone. So, what do we need? Number one, an integrated heat and air quality early warning system. South Africa currently has weather forecasting and air quality monitoring systems, but these are largely separate. Policymakers need integrated systems that provide combined heat and air pollution risk alerts linked to health guidance and response actions. But we also need to increase the evidence that we have on these health effects. And in some of our areas, we have very badly maintained air quality monitoring systems as well. So we need to take that into account. We need better health surveillance. We need real-time systems that connect climate, air quality, and health data to identify emerging risks and guide interventions. Such systems can help predict health impacts before they occur, rather than only documenting them afterwards. We need protection of vulnerable populations. Policies should prioritize schools, healthcare facilities, older adult homes, informal settlements, and outdoor workers. This includes cooling interventions, heat health action plans, improved ventilation, clean energy access, and occupational health protection. Urban planning for climate and air quality. Cities need more green spaces, shade, climate-sensitive building design, active transport infrastructure, and cleaner public health systems. These measures simultaneously reduce urban heat and improve air quality. Stronger emission reduction policies, reducing emissions from industry, power generation, transport, and household energy sources remains essential. Cleaner energy systems provide both climate mitigation and immediate public health benefits. A multi-hazard risk assessment. Future policy must move beyond considering heat and air pollution separately. South Africa needs a multi-hazard approach that considers how heat, air pollution, drought, wildfire smoke, flooding, and social vulnerability interact to affect health. So, a key message for policymakers. The evidence is already clear that both heat and air pollution are major public health threats in South Africa. The next step is not simply more monitoring, but developing integrated climate health systems that anticipate risk, protect vulnerable populations, and support timely action. By combining air quality management, climate adaptation, and public health planning, South Africa can reduce disease burdens today while building resilience for a warmer future. Thank you.
Thank you very much, Natasha. That's encouraging that we know what we are thinking about or what we need to be thinking about, especially as people gather in Pretoria, but also clearly something that also requires more integration, more silo breaking across different groups that may be thinking about heat and air pollution and health and intervention. So thank you for bringing those to light. I will now pass the baton back to Obianuju to help us guide through some questions. And if you have questions for the panelists or you would like to hear from them, please put them in the Q&A box so that we can address them. Obianuju, over to you.
Thank you so much, Alavi. That has been very interesting discussion so far. And we already have a few questions in the chat box. But before then, maybe I ask one, so just to break the ice. And we all talked about vulnerability and for children. And in Africa, we know that urban planning is something that is a challenge. And we have schools sited on highways and close to dump sites. And this is something that is really preventable. I'm sure Rebecca can speak to that because studies have shown that many children, most of their exposure actually occurs in schools rather than at home. And I think that's a low-hanging fruit. So maybe I'm making a comment as well. And an important area that is implementable in the current future. So I wanted to hear from Rebecca and maybe someone else about schools and when we think about children and vulnerability.
Yeah, thank you, Uju. I think first of all, we have to realize that in most countries in Africa, children spend most of their life at school. For example, in Uganda, you could be in school at 6 a.m. and maybe until 6 p.m. you are there. And probably you are at home maybe 3 months out of the 12 months of the year. And so schools become a very important place for children to have healthy lives. So we did a study in 6 countries in Africa looking at children with asthma, and we monitored air pollution for 5 days, looking at their homes on the way to school, but as well as the school environment. Whereas we think that schools are safe because maybe they are paved or they have green spaces, most of them, especially in urban settings, do not. And we found that many children are exposed to high levels of air pollution in school, but also while they move home. So it's important to try and find out where do we put our resources when we are trying to protect the children. I find that schools may be a little bit easier because they are well-defined environment. Children are there most of the time. And for boarding schools where they also cook, for example, using firewood or charcoal, probably it's easier to transition to cleaner fuels. So we need to invest in interventions that also look at school as a common place where children actually live, and their health is very important. Thank you.
Thank you, Rebecca. I thought it was important to bring that up as we think as advocates and policymakers ourselves. So in the chat box, we already have a few questions. Jennifer is asking, is there any industry to be held accountable on the issue of clean air, just as is done with tobacco and alcohol industry? I think that's a great question. So let me pose it first to Maria. Is she still on the call? Yes.
Yes,
Maria.
yes. Thank you, thank you. And it's a very, very important question because on tobacco, at least we knew very well who was the interested and the conflict of interest. It was the tobacco industry. Here, in terms of energy, we have several, but essentially there are those oil producers that are the ones kind of putting on a very slow pace the transition to renewable energy. So fossil fuels industry related and the subsidies that the governments are giving to the fossil fuel industry are creating a major obstacle to advance on the transition to cleaner sources of energy, and at the same time are somehow responsible for the public health problem we are having. But to finish with something positive, there are other type of industry that can make a lot of benefits, economic benefits, by putting in place this solar panel and the innovation that is needed, and helping to transition to renewables, which will be the ones that will be protecting our health. So there is employment there. There are opportunities for working opportunities. There will be an opportunity for the economy, and of course, a major opportunity to protect our health and to reduce the cost. So there is still business. We don't want to kill the business. We understand that if we want to protect people's health, we need good economies as well, but we need to shift from the fossil fuel industry to something more cleaner, renewable, cheaper, affordable, and sustainable.
Thanks. So anyone who is involved in use of fossil fuel is someone we can hold accountable. That's what we're saying. All right, that's interesting. What is the economic cost of failing to guarantee clean air compared to cost of acting? Is there any country that is with the best standard to follow? So maybe Maria, you take this question as well before I then move on to someone else. Yeah.
Yeah, I'm sure that others might have as well a good contribution to this. But, can you hear me? Yes.
Yes.
No, I'm saying that others might have as well very good contribution to this. But at the moment, the cost of inaction is particularly paid by our lungs, by our health, and by our hospitals, because those who are using arguments to postpone the decision to transition from transitioning away from fossil fuels are the ones saying that it will require some investments. But those investments are already paid by our health system and by the health of our citizens. So those investments will be definitely pay off for what we are doing now. And it will be more sustainable once again. There are countries that, like China, who understood that there are no business if you keep polluting your environment, and particularly the air your citizens are breathing. And they are moving now for economic reasons as well into electric cars, for instance, in the big cities like Beijing or Shanghai, where the levels of pollution before were very, very high, and now you see a massive reduction on the pollution levels, and their economy keeps growing up. So we can take as well the Scandinavian countries where they have very healthy economies. And of course, they are respecting the environment and transitioning as much as possible quick to the renewable energies. And more recently, I think Spain in Europe has demonstrated as well that because we have solar energy, is an energy security as well. With the geopolitical situation and the war we are facing now, you need to ensure less dependence to fossil fuels. And I think the investment Spain did on renewable energy is now proving very good results. So yes, for Africa, it will be a fantastic opportunity to move into renewables. But of course, there is a political issue as well that the countries need to be engaged on it and decide to go to that path and not to others. It's a political choice, definitely.
Thank you. Let me ask Labram, do you have anything to add in terms of the cost of not acting? You talked about the effect of air pollution on health, particularly in non-communicable diseases. Is there anything?
Yeah, thank you. So let me just add on to what Maria just indicated. Yes, indeed. The onus always lies on government to ensure that it protects its people from the harm. That's causing, for instance, when it comes to matters of tobacco, even with that, the Framework Convention on Tobacco Control, Article 19, that talk about liability. So for instance, if you have evidence that the industry is the cause of maybe your cancer, your respiratory, then you can take the industry on. But that this is somewhat indirect, right? But when it comes to air pollution, it's very visible. We see the damage. Sometimes it's not even the big companies, even the smaller ones that we see in our communities, right? They pollute to the extent that you can see that this is harm. So for me, I think that we should begin to look at how do we ensure that government, begin to understand why it needs to, come up with its own policies. We don't sometimes need this global convention before we act. We must look within and then act accordingly as much as we can. Now, and then possibly also stop the importation of used, old, and bracketed cars. In Africa, we would always import in our part of the world. So you would have many of the cars that are used in my country are cars that are old with a lot of, smoke from the exhaust fumes, polluting and destroying, and human health, causing and increasing the disease that we're talking about. And, I forgot to mention the fact that, when these things happen, many of those who are affected are children and women, because on the streets are our women, on the streets are our children. And these cars are mostly, come out with these huge exhaust fumes. So for me, I always see air pollution interventions to be more of policy issues, and governments must be held accountable for reneging in their responsibility to protecting the people. Right. Now, the matter that I talk about, the issue of investment cases and then the cost of inaction. Indeed, we would go in cycle if we don't put a stop or have measures to educate people or to create awareness or to have policies that will reduce air pollution. So taxes could play a very major role, imposing taxes on polluting industries, or better say, ensuring that you hold them accountable for the cost they are causing the environment and probably also human health. And then ensuring that there's policy alignment. The Ministry of Health of countries must take charge. When the climate events are taking place at the UNFCCC, hardly will you see ministries of health. Well, maybe I'll speak to my country. Hardly will you see Ministry of Health participating in such, events. But when it comes to matters of air pollution, it's about health, and we should see how we integrate or multi-sectorial collaboration should be the way to go to ensure that we're able to understand the extent to which the damage is coming from, from air polluting entities and probably the environment. Thank you.
Thank you. Thank you, Labram. We have a couple of questions now, so we need to take some of them together. There's the question about saying the problems in DRC with the mining and all the sources of air pollution we know that occur in Africa. And then we also know about the Port Harcourt. So Port Harcourt is the oil refining area in Nigeria where we get most of the fossil fuel that powers the economy of the nation. And they've been dealing with soot for several years. This is soot that settles on clothes. If you hang your white outside and come back in a couple of hours, you actually see that. And people have lived with that for years. And someone is asking, what are the long-term health risks? I think that's where we need to do the research, because we have to provide the evidence. We have to provide the evidence to our policymakers to say that this is the problem. And some of these health effects take several years. For example, if you think about lung cancer or even cancers in general, as a result of exposure to soot, this takes decades to happen. So for us as healthcare workers, I think it's our responsibility to provide the needed evidence to be able to move policymakers. We can start with short-term evidence, such as increase in respiratory diseases, lung function, blood pressure, birth outcomes. Those are short-term evidence, while we also work towards the medium and the long-term evidence. Like we say, the problem with air pollution is that you see the effect much later, and many times you don't even see it. But in this case, you actually see it. So I think we need to provide that evidence that we will use to engage with the policymakers to be able to make the policy change. As Labran said, most of the work lies with policy, because policy, people are not empowered. People need support to be able to do the right, to be able to empower them, particularly in Africa, where poverty is very high. So people need social safety nets, they need subsidies to help them, and all that lies with policy. Someone is asking about how we can work with women-led organizations to increase their capacity to advocate. And I think Bertrand has talked a bit in their experience in Cameroon and on things they've done to increase awareness in the community. So Bertrand, what would you say about this? How can we work with women-led organizations and other social groups in the community to increase awareness and accountability for clean air?
Yes, thank you,
Bertrand.
Uju. Yes, in Cameroon, we don't have much experience in involving musicians in this fight against air pollution. We have been working with local communities where we conducted study on air pollution. But currently, we have just installed a reference air pollution in the hospital where I work, and the launching ceremony will be next week. And we are intending at this time to involve local authorities and schools as well. We didn't preview to include musicians, but maybe during the course of the surveillance of air, or at the end, we could probably invite them during the stakeholder engagement at the end of the study. Thank you.
Yeah. I think it's important to think about ways to engage the community. Community awareness, we need to promote citizen science where people advocate for themselves. And there was a question about the donor cycle. When the funds run out, what happens to the gains that we had during the studies? Again, that has to do with educating the community, promoting citizen science where we can advocate for ourselves. There are other comments here about diesel cars and importing old used cars in Africa, and I think that has already been addressed. And the work being done in South Africa, we know South Africa has a lot of problems with mines, and they talked about the hotspots. So let me ask our colleagues from South Africa to tell us about how they're engaging the community also, and how they can promote citizen science beyond the course of this partnership with the Royal College of Surgeons. How do you intend to sustain the gains you make from this project? Claire?
Hi, yeah, it's a challenge. I don't think I've got the answers for you yet because it's our plan and not something we've actually done yet. But our plan is to go through the doctors and the clinics and people who are working, they're seeing patients every day, whether that's pregnant women, whether that's children coming for immunization. They're engaging with those people every day. And if we can educate the doctors and nurses working with those patients to have those discussions, as part of a routine checkup, that's kind of our plan for now. But I'm sure there's many other ways that think these things can be done as well.
Okay, thank you. Bertrand, you have something else to add? Bertrand, you raised your hand. Okay, I don't think so. Maybe he's not aware. I'll have a question here. Okay, Bertrand, yes, go ahead.
Okay, yes. So I'm saying that another way of increasing the awareness of concerning air pollution in the different community could be the use of low-cost monitor, because they can be used by populations. So I can imagine, we have thought about schools. We have area where people do sport, and I think by using low-cost monitor at the level of population can also, increase awareness and help authorities in this fight against air pollution. So that was my contribution to that.
Yeah, that's true. You can't address what you don't measure, right? So I think we need to measure to provide the evidence. And there's a question here on how successful has community litigation been with respect to holding big polluters accountable? I think that's a very important question. Does the polluter actually pay in the end, or is the process frustrating and long? Does anyone have an example or experience with litigation to high polluters? Please jump in if you do have this experience.
Hi, if I may. There are more and more examples. Pallavi, I'm sure that you wanted to add on this one as well, but there is an association called Client Earth, and they are taking to tribunal several countries and several initiatives, and they have been very successful. Of course, this is only growing. Everything related to legislation is now growing. And I think it's important to remember as well that this year that the International Court of Justice, The Hague, we were, as WHO and many others, we participated to hearings where they wanted to hear about the impact of the combustion of fossil fuels into the health of the people. And I think that was very, very powerful as well. More and more legislation will be an important tool that we need to keep using, and all of these samples and initiatives that different groups and NGOs and lawyers are taking action on it will provide very good results. Don't forget, and somebody was mentioning on the chat, that there is an economic, there is money in the middle. So probably those big companies are very successful in terms of mobilizing a troop of lawyers and resources. But the more the citizens will understand what this represents for their health, and the fact that there are other options that are even much, much better, there is no reason why Africa is not electrifying now on solar energy. There is no reason for that. There are no obstacles except the money that some companies are making and probably some policy as well, and the fact that there is no political willingness to engage on this transition that, as I say, will be very beneficial from an economic point of view, in addition to health to the country. So yeah, we need to change that business approach to still business, but with the protection of human health at the same time. We can't hear you.
I think you're mute.
Oh, sorry. Thank you so much. I think we move on to the last words from the panelists, right? Because we're almost close to the end. But there's a good another example in the chat from South Africa on litigation. So please have a look at that, and then I'll hand over to Pallavi to conclude as we get the last thoughts from the panelists. And she has a key question to ask all the panelists. Thank you so much.
Thank you so much, everyone. And I know we weren't able to address all the questions, but hopefully we can continue these conversations and come back to some of these critical issues. When I started the webinar, I said, this is sort of a precursor to the Africa Clean Air Forum, which is happening between July 13th and 16th in Pretoria. And we're hoping to see some of you there, both panelists and attendees. And I think as we end this webinar today, it is only fitting to ask our panelists for really quick 1-minute reflections on, for those who are gathering in Pretoria next month, which is a mix of policymakers, government representatives, civil society organizations, researchers, what is your one message for them? And if that seems like too much, then, maybe what is the one critical thing you think we need to do to ensure clean air for everybody in Africa? So I will go in a random order, but Labram, could we start with you? I really request all of you to keep your responses as short as you can.
Yes, so thank you very much. In terms of short, I'm not sure, but I mean, just a quick one to say that we should, hold, government into account to ensure that the fourth high-level meeting on NCD and mental health, which has, mainstream issues of air pollution, in it should be, should be implemented before the next UN high-level meeting. And also to say that Ghana, through the support of Clean Air Fund and then also the UNDP, has developed the Ghana investment case on air pollution. And hopefully it will be launched soon. And I'm happy to be part of the stakeholders who actually worked on it. And to tell colleagues and friends who are attending the conference that indeed air pollution is a health matter, and we should try and see how we integrate health air pollution into non-communicable diseases and ensure that we are able to correct the wrongs that have happened in the past, just so we protect public health from the devastating effect that it had on previous generation. We say no to air pollution. Thank you. Over.
Thank you, Labram. Rebecca.
Thank you, Pallavi. I think my one message as a researcher is that as we design interventions, whether household air pollution or ambient air pollution, we need to involve the communities, we need to involve the citizens, whether we are talking about involving healthcare professions. When we are making these strategies, we need to involve them because, as we may realize, issues around air pollution have a lot to do with behavior. And therefore, if we ignore the people who are affected, who are the generators of the air pollutants, if we don't put monitoring mechanisms and evaluation mechanisms, it will be difficult for us to generate evidence that these are the strategies that work. So I really like researchers and policymakers as they develop these strategies to involve the citizens in these discussions right from the start. Thank you.
Amazing. Claire.
I think my messages work together. Avoid duplication and action more than talking.
Fantastic. Love it.
That's my
Maria.
Yeah, I cannot agree more with that. Definitely, this partnership of health professionals is fundamental. The voice of the health professionals to use the health argument to promote this need for an investment on clean air for Africa. We need to look for evidence, of course. We are always, as scientists, we are always looking for evidence, but the evidence we have is more than enough to allow us to promote very, very strong interventions, particularly on access to clean fuels at the household level, and then interventions to reduce air pollution at the outdoor level. Cities, mayors, work with mayors as well. The voice of the health professionals, the health argument with mayors works very well because they can transform a city and then providing the sample we need to reduce their pollution and making a city that will be even very good for business.
Fantastic. We do expect some mayors at the forum, so this is great as a message for them. Natasha?
Hi, yeah, I share Rebecca's sentiments in involving citizens in public health research. And as a researcher, I am very close to the great challenge that we have in gathering evidence. I live in KwaZulu-Natal, and in this province in South Africa, we have very little air quality monitoring, proper air quality monitoring here, but we have growing industry. And I've spoken to a lot of the community about the problems and the health challenges that they have in response to air pollution. So I think even though gathering evidence is a great challenge, we also really need adaptation and intervention studies, and we need low cost solutions for these low-income communities. Thank you.
Thank you, Natasha. Bertrand.
Thank you, Pallavi. So I would like to raise the fact that I think if we include what I would call a triangle made of researchers who will gather evidence and then convince the second aspect of the second angle of the triangle, and convince policymakers to help in solving this problem of air pollution. And the third angle is the community. The main cause of air pollution is anthropogenic. So finally, if population is really convinced of the reality of air pollution, I think we could address this issue. Thank you very much.
Thank you. That's excellent. And last but not the least, Obianuju.
One thing I think is awareness. The population needs to know the dangers. They need to understand the risk. If we don't do that, then people feel you're infringing on their rights, on the things they do. So I think it's important we improve population literacy, and we also improve population awareness and equip them to advocate for themselves. Thank you.
Amazing. I think those are very, very actionable set of sort of recommendations to bring from the health community to the forum next month. Thank you very much again for joining us, for sharing your perspectives. And we hope to continue this conversation after the forum and continue to go down the path of action, more actions and less words. And I think I will end by saying that we really do have the evidence and the data that is needed to start taking action towards clean air. We need to generate more, of course, and think about adaptation, think about intervention, specific communities. But we really know where to begin. We know what data can be used to support it. So hopefully we can all come together to push for that action and to think through what that looks like. But for today, thank you very, very much. We will make the recording available. And once again, a big thank you to our collaborating organizations and to all the speakers and panelists who participated today, and hope to see you all soon. Thank you very much.
Thank you. Thank you, everyone. Goodbye.
Bye.
Yeah, goodbye. Thank you.
Thank you. Bye.
Thank you.